then are still relevant today. So what I thought I would do is go through some of the key areas around admissions and how we, as in terms of admitting and people on the admissions committees, think about these various areas and what I look for, and having been in enough discussions now at the committee, know that other people look for, the other committee members look for in terms of applicants for medical school. But I wanted to start with, I think, and there was one of the questions that was submitted as from an individual who was potentially going to participate on the webinar, is you really need to make sure you want to be a doctor. You need to really decide whether your interest is in directly seeing patients, and I'll talk a little bit about my career in a minute, but whether you want to directly see patients or whether you really want to look at policy work or changing the system or working in other aspects of healthcare, of which there's just a myriad of options, of course, besides, literally being a physician. I am a board-certified general preventive medicine physician. I've done quite a bit of clinical work earlier in my career, but now, for those of you who know, I'm the CEO of Inland Empire Health Plan, which is a large Medi-Cal managed care plan in Riverside and San Bernardino counties. And so my career changed from directly providing care in multiple settings, including running a jail medical system as the medical director and physician, to administrative positions like I'm in now, which is I was originally the medical director, then chief medical officer, and then appointed as CEO about 9 years ago. And so interestingly, I think it's great that I'm a physician CEO because I think it gives me a perspective that's very different and very positive, but most CEOs of health plans are not physicians. And so thinking about, thinking very seriously about whether, you really want to know and really want to spend the time and effort to be a doctor, and also thinking about, do you want to do medical, do you want to do behavioral health, do you want to do that direct patient care versus care management or support? Really important to think about it. And the reason why it's so important is that it's a major financial and time commitment. Unless you have an independent source of funds or you join one of the programs that puts you through medical school, you're going to probably come out with very large loans, which affect your financial status for a very long time. You're going to be in a residency program where the pay is relatively low, relative to certainly eventual physician jobs, and you have a real significant delay in your income. I mean, for me, it took me 4.5 years to get through college, and then I did go to medical school right away, but by the time I was done with residency, I was in my late 20s, 30-year-old, so my real income start was not until that point in time, whereas if you, did a more traditional route of, say, college and then maybe a master's program, you'd start earning income, younger. So really thinking through the financial commitment, whether being a physician is what you really want to be, because of the time and energy and money that it takes to become a doctor. And then last is, being a doctor is not easy. There's a lot of burnout, a lot of, medical delivery systems have changed. They're going to continue to change. The role of the doctor is still a great role, but really thinking through whether that's what you want to do. So you got to get that clear, in my mind, before you really pursue trying to get into medical school, because of the time and effort that it's going to take to get into medical school. So kind of thinking through how it's looked at, there is a first cut where there's an examination of, the grades, specifically your grades in science courses, and so they do a GPA for science, they do your overall GPA. Now, interestingly, I and other admission committee members do look at the school you attended. So I do take that into account when I look at what school you attended. I do look at whether you attended junior college and then a 4-year, did all 4 years, and where those schools were. I don't weight that heavily, but it is a factor in looking at GPA and courses in science. Interestingly, there's some of the committee members that I've worked with that don't think about that. They really just look at, have you taken the prerequisite science courses, how did you do in them, et cetera. And so that was actually, I bring that up because it was actually a discussion last night about a couple of candidates that had taken a somewhat non-traditional route in terms of school. And where that works is if you're coming from a different setting or a different background or a different timing, and so a typical four-year school college environment may not work. And so in that I take into account, but if all things being equal, I do look at the school, I look at the grades, I look very carefully at your courses. We get a full transcript, and so we look at specific courses, how you did in organic chem, how you did in calculus, how you did in the courses that are biostats, that are harder, to see how you've done. And so GPA is not a be-all, end-all, because we do look at MCAT pretty close, and if we see someone with a GPA in the lower threes, but they did very well on the MCAT, then that helps in terms of the belief that you will be able to handle the rigors, the science rigors of medical school. And so those two are kind of put together. They do look at the MCAT of the cars versus the science versus the biology. They do look at that and examine sort of the breakdown. So it is looked at pretty closely in terms of kind of looking at that first cut. I didn't mention personal statement, but I'll mention that briefly. Personal statement, how it's looked at a lot, is generally something that can hurt you rather than help you. And the key is that your personal statement is consistent with the rest of what you've done in your life and in your various extracurricular activities and even possibly your research. So the personal statement really is consistent. If we see something in the personal statement that then is not reflected anywhere else, so I'll take an extreme example. In the personal statement you talk about really wanting to work with vulnerable populations or low-income populations, and yet there's no evidence of that in your extracurricular activities or anywhere else. That's going to be a negative because you're saying it, but there's no proof that you've done it. So to me, the personal statement is an opportunity to traditionally talk a little bit about what motivated you or sort of made you think about medicine. I've seen many variations on that theme, but I like where it talks about the commitment, and then that's reflected with specific examples of things that you've done in different settings, worked in a free clinic for extensive period of time, et cetera, et cetera. So those kind of get wrapped together with a heavy emphasis on the GPA and the MCAT and some look at your background and where you've come from to look at secondary applications, so taking UCR specifically. So that gets us to where now we're going to start to look at, so I literally go down in the flow sheet. I go grades, school, detail of grades, detail of classes, MCAT, and then the next thing that we look at is your experiences. It's called, your experiences on the MCAT application. And so there, if we can go to the next slide, there what we're looking at in terms of experience is, the different what I call sort of venues of experience. So for research, I have a bit of a bias, not necessarily totally consistent across all the committee members, that looking at clinical research versus basic science, that if you've done research that involves patients directly, enrolling them in studies, doing surveys, interacting with them, I see that as a deeper experience and exposing you to what you're going to do in terms of connection with patients as a doctor versus real basic science. Now, in either case, what we're really going to look for is depth and commitment. I would much rather see one deep research experience that's longitudinal over time than 100 hours here, 150 hours there, 200 hours there. I like seeing substantial hours. I like to see clinical so that you're really showing a commitment to that understanding of how research, particularly in my mind, clinical research, fits into the whole medical delivery system process, because research is really important. So again, you're going to hear this theme throughout. Depth is much more important ultimately than volume. Although, caveat on that, you've got to show a number of experiences, but it's much more meaningful when it's a clear commitment over time and depth in any of the things I'm going to talk about. So research, to me, it's sort of clinical versus non-clinical. It's the depth and commitment. One very deep one, better than multiple shallow ones, because again, are you checking a box? Are you saying I did research? Or have you made a commitment to really learn what research is about? Because that ties back to, medical care and medical systems. So that is kind of how we think about research. In terms of the other experience, clinical is very important, and to me, clinical experience is where you really figure out whether you want to be a doctor, and so you have experiences that expose you to care delivery in a different settings. I think MD shadow and the committee generally really looks for physician shadowing. I do think that in general, this is UCR, a little bit UCR specific, so not necessarily true for other schools. We'd be looking for primary care shadowing, versus a dermatologist, for example. When I see a dermatologist, I say, okay, that's not bad because you get a little picture, but that's not the same as seeing the variety and the extent that a primary care physician would see. So I would, when you're thinking about clinical shadowing with a physician or in a clinic setting, probably not true for all schools, but certainly true for those schools with a primary care bent, that primary care is strong. You're connected to, one doctor, hopefully, because that can get you a very good letter of recommendation, which I'll come back to later. And again, depth. If I had a candidate last night who had 15 hours of medical MD shadowing, and that to me is not meaningful at all. That's a couple of days or an hour a day for a few days. You're really not getting exposed to the depth and complexity of medical care and understanding what the role of a doctor is. So these are tough. It's one of the harder things to arrange, because you've got to have a connection or know somebody, but, can be done, and it's frequently done. So trying to get a pretty good longitudinal experience is helpful. And so I'd like to see, typical is probably, I'd say 60 to 80 to 100 hours. I'd like even more, because that means you really spent time with the physician, with the patients. You're seeing the variety of patients. You're understanding the difficulty of working with people around their health care. So that one to me is really key. Now often that can be hard to do. So a lot of people do emergency departments. A lot of people do hospital care extenders. COPE obviously does some of that. My bias would be that, I think ED is actually interesting because, again, you see a wide variety of patients that are often in extremis, and by extremis not necessarily clinically, but, they can be very upset and frightened. And so, seeing that kind of interaction between physicians and patients in that setting, different than primary care, obviously, but I think not bad. Sometimes easier to arrange. Working through the ED. So I see ED as pretty good. Hospital a little less so, because that's just one slice of the healthcare delivery system. And my bias is, in our health plan bias is, really work on the outpatient side. So hospital not bad, because again you're having that patient experience, but it's an unusual experience. The patient's in an unusual setting. They're not often not ambulatory. They're obviously there for serious reasons. So, I still look at, physician shadowing being kind of the best scenario, ED probably number 2, hospital after that. And then other things that are unusual, like we've had people who have been EMTs. So that's real from an interaction with patients, often in, difficult settings, but doesn't really give you that experience of what it means to be a physician delivering care. So good clinical experience, EMT or that kind of experience, but not necessarily what we're looking for around that physician connection experience. So clinical to me is back to same theme. You're going to hear this the whole time. Time and commitment, depth of connection, not just checking the box. It becomes fairly obvious sometimes when people dip in and out with short periods of time, and not really, living that experience, which is what, we're looking for on the admissions committee. So good. So the other kinds of activities, though, that also are good are what I would call mission work, and this is often overseas. Again, I'd look for length of time. You're not going there for a day or two. You're spending some significant period of time there. You're working in a setting where, you're experiencing healthcare, so and often their mission and their clinics overseas, which can be very real. They can be very real in terms of the intense experience with the patients and the doctors. They're not healthcare here, so I'd still want to see healthcare here, the physician shadowing or whatever. But, it's a commitment. I mean, I think it's a significant commitment to, either be involved in the logistics or the delivery of care in a foreign country. I see a lot of brigadier. I see a lot of fish. I see a lot of other entities that do it, and that's okay. I mean, to me, it shows commitment. I mean, it's a big deal to, spend some time overseas in a difficult setting, but I wouldn't want that instead of, good clinical experiences in the United States. So same thing, depth as much as possible. Now, other volunteer work, free clinics or working with children in some setting, or, tutoring TA, those are okay. Probably not going to be a deciding factor. But again, if I had a candidate last night who had extensive experience, both volunteer and eventually working in a domestic violence shelter. That to me is significant. That's a vulnerable population. Earlier in my career, I worked a lot with battered women, and that's a very, very complex psychological and physical scenario. And so to me, that was significant. She showed real depth, real commitment, worked there as a volunteer, eventually got hired actually, and was working there after her college years, while she was applying for medical school. That's significant in terms of its commitment, in terms of the population, and this particular applicant's depth of commitment there. So good stuff. Make sure you communicate well what it meant and how it fit with your other thoughts about medical school. So good, probably not deciding factors, but again, create this well-rounded applicant who, has been involved in things that really tell us that there's a commitment to, a population, as in the underserved population, if that's your interest, or, medical care delivery in general. Now, work is interesting. I really respect work during college and work afterwards. I mean, I really respect that. And so, putting that forward clearly, and what it means to you, particularly if it's work that, in the case of the individual in the domestic violence shelter, or I've had examples of people that have done therapy for autistic children, those are very valuable. And I'm going to talk about letters of recommendation next, but work can be a really, really valuable source of a letter that can have a big impact on the committee. So yeah, let's go to the next one. Thanks. So letters are really important. I'll go to secondary application in a minute, but I want to finish with letters and then I'll go to that. So letters are really important because, I'll give you an example. So let's say you do the interviews, and I'll talk about interviews in a minute, and you don't do as well as you'd like, because you're nervous, or, it's that process that we use at UCR where you have 8 minutes to answer questions. You move from, station to station. It's pretty stressful. And having been an interviewer, I mean, it's stressful. I mean, I sense the stress on the other side. So letters fill it out. So I'll give you a specific example. We had an individual who was actually below average on the interview score. So they do a Z-score for interviews. It's, it's semi-objective, I think reasonably objective. But his letters talked about engaging, connecting, great communicator, and I mean, those are real. Those are longer-term relationships than, an 8-minute interview. So to me, the letters are important to really reflect who you are, and in some cases can, I don't know if this is the right word, but can, explain or help overcome other deficiencies, that that may be there, like if you have a bad interview. So letters are really key for us at the end of the day. We're looking at numbers, we're looking at your writing, we're looking at your experience, but letters make you real to us. And you know, what I look for, excuse me, is letters from different venues, again, kind of venues related to your experience. So academic are good, but they can't just talk about the class. They can't just say, you know, Bill was a great student in my Chemistry 101 class. He did really well. He got an A. You know, he asked a lot of good questions. It's better if they speak to you and who you are. That can be hard depending on the particular class, but I can tell you I've had really good letters. I had one of the best letters I've ever read from a summer school chem teacher who gave a letter of recommendation for a candidate we reviewed last night. Was actually one of the highest scoring candidates I've ever reviewed. And this letter, it was clear that they had connected, that there were conversations, they were real, and really spoke to her character and her, you know, inquisitiveness and her, you know, her motivation and her goals. You know, so she spent the time having real conversations with this person, obviously. And so not fake, you know, real conversations. And so academic, you know, are okay, but I'll tell you the ones that I tend to like better. But again, they can't just be academic. And I know you don't get to see them, but it means that you want to ask those individuals that you feel like you have, you know, a more deeper relationship with. Research, you know, we're looking for your work ethic in that setting, your ability to innovate, your ability to self-direct, and again, not, you know, this is not short, not this is one of my best lab, you know, assistants ever, you know, that you've done a depth of work in that research setting and you've taken initiative that, you know, again, you get a review that's a letter that's more meaningful, more, you know, has more depth to it, and not short. I mean, I would say I've had some short letters that were outstanding, but, you know, generally not a bad thing if they take the time to really talk about who you are as a person. And that's hard. I mean, having been a person who's had to get letters of recommendation, that can be hard. But that's why I think the best place to get them is where you've had a real depth of commitment and work. And so one of the things that's a bit of a red flag to us is if we see that you spent, I mean, 500 hours, 600 hours, 1,000 hours, which I see in a research, you know, clinical setting, and yet there's no letter from the lab director or someone you worked with or your direct supervisor, because if you spent that amount of time and energy and connection, I generally would expect to see a letter, you know, that because, you know, there's that level of commitment. So research, so academic research, clinical, we're looking for, you know, relationship with patients. That's really key when they can comment on that. You know, how you got along with staff, work ethic, again, your dedication. I'll tell you, letters that are just great are if you do a good physician shadow and that physician is willing to write you a letter about how you interacted with staff, how you interacted with patients, how you learned, you know, hopefully quickly around, you know, disease and medical issues. Those are very strong when you've had a clinical experience and someone can really speak to your relationship with patients and the other staff and the physician or, you know, who's ever your supervisor. So clinical, really good. Volunteer, good. Again, I'd be looking for, you know, real comments on who you are as a person. So, like, for example, there was a letter from the woman from the that was at the domestic violence shelter. Very good letter. Clearly knew the person well. Could speak to her, you know, commitment to the population. Speak to her, you know, non-judgmental understanding of these women that are very vulnerable and often in a very difficult psychological state. So, you know, very meaningful letter. So that one was good. Again, you know, I'm going to look for, you know, that clinical letter is probably my number one. Research can be good. I've had some phenomenal research letters. Had one last night that was, I mean, again, one of the best letters I've ever read. You know, that clearly an outstanding person, that, you know, the student. So those can be good. But I probably put clinical number one, research number two, depending on your length, academic. And then work. I have to tell you that personally, and we talked about it last night because we had a couple candidates, work is a big one. If if you're doing work, whatever it is. I had a candidate last night who was a hazmat specialist. Actually, wasn't one of my candidates, one of the other presenters, hazmat specialist for a county, and the letter from his supervisor was outstanding. Really talked about how he approached work, his attitude, his approachability, his communication skills. So even though it was kind of not relevant, really, I mean hazmat mildly relevant. I did public health, mildly relevant. It was really a good letter, and so. And sometimes the letter itself, regardless of where it came from, can be very meaningful. But, again, letters that are pertinent to how you interact with patients, how you interact with a team, in terms of team care of people, can be at the end of the day a little more meaningful. So letters are really key because they give a flavor of really who you are, versus your grades, versus even, your experiences, versus even how you did on the interview, et cetera. That really can speak to, who you are as a person, which is ultimately the decision we want to make is, is this person capable of the medical school curriculum? Are they capable of being a physician from sort of a scientific capability point of view? But, right next is, because that's kind of a threshold question, right next is, who is this person? What's their commitment? What are their interests? And for those of you who know UCR, there's a very, very strong bias around primary care, around underserved populations, around ethnic populations. So, UCR, pretty heavily weights, local experience, local connections, and that commitment to underserved, particularly primary care. So that's a UCR thing. I mean, I think there's other med schools like that. There's others that maybe not so much, so so that'll be different. But everything else I've said I think would be very consistent in terms of what people look for. So we do at the end at UCR, we really look for mission fit. What setting do you want to be in? And your information has to be really consistent. The minute we see inconsistencies between your personal statement and your experience, or your experience and your letters, where you say that you want to do X, serve the underserved, serve, the Latino population, but we don't see that anywhere else, that's a red flag, that there's not a consistency in terms of your commitment, which is hard. I mean, in terms of college and your experiences, not necessarily going to be 100% consistent because you do different things, but there should be a theme from who you are in your life and your experience as to, is it real that you want to do the things that UCR is looking for. Now, we do like local connections, that's a big deal, but that's specific to UCR, and our goals for really trying to get people who live here, want to work here, and biased with IEHP, want to be doctors that take care of IEHP members. And that frankly is part of what I look for, in terms of not specifically IEHP obviously, but primary care, underserved, or specialty. Specialty is key as well. So couple last things. One is interviews. How do they fit in? I was an interviewer. What I look for is logical thinking and reasonable presentation skills and an ability to create, and this is 8 minutes, a bond, a little bit of a bond with me. I'll tell you a funny personal story. So I did Kaiser. I was a Kaiser doctor a number of years ago, and I did urgent care for them on the weekends, and we would have enormous number of patients come to the urgent care, and we would be backed up people would wait for 1.5 hours to 2 hours, sometimes 3 hours, which I really didn't like. I really don't like that kind of scenario. I had 8 to 10 minutes to bond, connect, get a medical history, do the physical exam. Obviously took longer with more complex patients, but I felt so pressured by the volume that I wanted to really keep moving, but in a good way, so that I had to learn how to connect with people really quickly, and I had a whole methodology to do that, and it generally worked. And of course I took the time needed with the more complicated scenarios. But that's, I think, part of what the whole interview process of the 2 minutes to prepare, 8 minutes to present is your ability to connect, your ability to present, and your ability, of course, to address the question at hand. And so that to me is the key to the interview. And it's tough. You get 2 minutes to look at the question, and then you got to come in and be real. And so that, I think is actually quite difficult. So that's back to that. If your letters help us really see who you are, that can overcome, a bad interview day. We do like it if we see it all fit, where there's a really good interview score, plus the letters talk about ability to engage and communicate. But the letters can help if it's a bad day, and that can happen. I mean, I've had individuals, I tend to be a sort of a helpful interviewer. I'll prompt, just because I want to hear how people think. But not all interviews do that. So last thing is the secondary application. So you're asked to come back, you do a secondary application, and I'll tell you a couple of sort of not funny, but stories. Is one of the questions, which I think is a really good question, is what major problem have you experienced in your life, and how did it affect you, and how did you think about it? So we're looking for depth there. I had one person who presented that stage fright. It was essentially stage fright. One time was a major problem in their life, and that didn't feel right to me, because that's significant. But if that's the biggest problem you've had in your life, then you've had either a very easy life, or you haven't really reflected on things. And then the second one was an individual who said they were upset. Their major problem is that their current significant other was in another country, and they were having a long-distance relationship. Not to minimize the difficulties of a long-distance relationship. I did at one point in my life, and it was difficult. Again, I don't see that as the major problem in someone's life. I mean, if that's the biggest barrier or issue you've had, and it's recent, how would you, either you've had a very easy life, or you're not really thinking through the question. So, being thoughtful about that one. And then again, all the other questions: what do you want to do? How do you see, what kind of doctor do you see yourself being? Make it consistent, make it real, and make it consistent with the rest of your application, so that we see, yeah, this person's had these experiences, they're writing this in their personal statement, what's thought, had them think about being a doctor, and now in the secondary application they're kind of closing it out by saying, here's what I want to do. I want to be a primary care doctor in an underserved area. These experiences got me there, and that's what I'm really focused on. So you can hear kind of two big themes throughout. Is depth is good. Letters that really talk about you as a person, three things. Letters that talk about you as a person and who you are good, and longer better than short. And then three, consistency, so that we see this is who you are, which then allows us to make a good decision about whether or not, we think, and this is what we got to do as an admissions committee, that you'll be a good applicant for UCR in this case, and ultimately be, a doctor that fits with the mission and values of UCR, and really, being a doctor in general. So that's kind of, those are what we look at. It's not easy. I mean, I have to tell you that it's really difficult, because often there's subtle differences. Often it's, hard to differentiate. What I would say is some people immediately sort up, some people immediately sort down, but there's a big group in the middle, typical bell-shaped curve, that, really I got to take the time and really look at, all of the details, so that I can figure out, are they someone that, gets across the, the bar of where we're looking, or is not quite there, and that's, I want you to appreciate how seriously I take that, because I'm affecting people's lives, related to UCR, of course, not, not other med schools, and so you really take the time to try to figure out, where the person is. Again, the ones that are pretty straightforward in either direction, I don't have to spend as much time on. It's really the group in the middle that I look for detail and look for, all these things that I've been talking about. So that's hopefully helpful. That's, how I think about it. I've heard enough of the committee members that they think about it with some of the slight differences I talked about. There were some other questions that people had sent in, so I don't know, Alice, if we want to go, if there are any questions that anybody submitted, or if I could go into some of the questions that were sent as part of the interest.
So we do have some questions that people submitted during the webinar, and one of them comes from Rosie. She's wondering if you could elaborate on what you meant by mission work in one of your slides.
So that's my term. So it's probably not the best term. It's my term for something that is sort of mission-based. So I think of what I put in that category. So what I literally do when I categorize experience, I put clinical, research, community, mission, and other. And what I put under mission is things like overseas experiences where you're going and either you're doing the logistics in the United States for the overseas mission and going, or you're going on the overseas activity, working in a clinic, working in a public health setting. So I use the term mission for experiences around something that shows a kind of a commitment above and beyond a typical experience. And that, I would say what fits in there the most is the overseas experiences. I'm trying to think of other things that fit, because most other stuff I would put in community, like the domestic violence experience would be in community. I've had people that have done food pantries, so I consider that in the community section. Another mission one would potentially be a free clinic. Of course, that could also be in the clinical area, but if you were doing the logistics for the free clinic, you're part of a student-run free clinic, you're on the board of directors, that would be mission for me, versus if you're actually in the free clinic working with the patients, that would be clinical. So it's a little bit arbitrary, but it's just my way of sort of dividing up experiences. And again, we're looking for kind of well-rounded.
We also have a question from Brandy. Brandy is wondering whether it is appropriate to explain why a grade point average was low during a period of time due to family situation or financial troubles, or would this be considered as trying to give an excuse?
No, I don't think so. I mean, because we talk about it in the committee. I mean, I think if there's some, significant event that occurred, I mean, I can't tell you how many of these I've read where there's, a serious divorce or a serious medical or behavioral problem with a close family member where you literally have to take time off. So I think it's okay to explain. I think you can, do it in a variety of settings. You can do it in the secondary application. I mean, that could be a great example of a major problem in your life. I mean, I had one applicant talk about a really difficult divorce of a long-time married, his parents, and how he had to, engage and to some extent intervene. And so he had to, kind of leave school at time because it was a little bit distant. And so he presented that as a major problem, but he said, not by the way, but he said, and it really impacted my grades. And so, that quarter, he mentioned it specifically. And so then what I would want to see, so I'm fine with an explanation, but what I want to see is then a recovery. Then I want to see evidence that was, an anomalous or, specific type of problem that resulted in the grade issue, and I want to see, some recovery. PostBacks, if your GPA is, on the margin, you've had trouble with science, post-baccalaureates like at USC or CAC Claremont, I've seen those. I've seen some other ones that you do really well in, and you get a great letter of support. Those are very helpful. So if your grades in science, they're on the margin, your MCAT's, good but not, outstanding. We had a couple of 99th percentiles last night, which was crazy. Think about the postback, and of course that's a potential financial obligation. But if you show good grades, you get a letter from them that says, hey, this person, really, was there and good. That'll make a difference. That will absolutely make a difference. So that's another strategy if your college grades aren't quite as good or you had a problem with science. Because I got to tell you, we look at detail. So if you got C's in organic chemistry, depending on what else you did, that could be a negative. Again, not outweigh other stuff, but looked at. That's the detail we get to.
We have a question from Danielle. She's asking, the question is, for someone whose GPA is not as competitive, do you advise taking a gap year and improving by taking a post-baccalaureate, for example, or maybe getting a master's degree? And also during a gap year, would you recommend what would you recommend someone should focus on in terms of experience, work, clinical, or focus on academics?
So in that case, like I answered the first question, a post-bac or one of the masters that, but I would focus it, if your GPA is weak in science, then make sure your post-bac has science, there's a science component to it so that you can show, look at, I've gotten organized, I can do this, I can do it at a post-bac level. So post-bac is good particularly if your science grades are not good and your overall GPA is not as good. I've been impressed when I see a 4.0 in post-bac and I get a great letter about the person from the post-bac. That's meaningful. In terms of any gap year, you got to support yourself, so you got to get a job usually. It's nice if that job is relevant. Like I see a lot of scribes, I see a lot of other clinic work, medical assistant. I've seen medical assistant work, and that means you're continually being exposed to healthcare delivery. And if you still want to apply, if you're still applying for medical school, I think that's a good thing. So, but like I said, we had a hazmat individual, got a great letter, so that was actually very positive. I've had people who've worked at Target. I mean, you got to work, and so I like seeing the work, frankly, and then I like seeing a good letter from the work, regardless of what work it is. But I think it's a plus if that work is in the clinical area, because then you're showing a continued exposure, meaning you're really serious. You're continuing to be exposed to healthcare delivery, and you still want to be a doctor. I mean, that's meaningful. So, but at the end of the day, you got to do what you got to do, but then turn it as a positive. Get a good letter. Explain why you had to do it. And if you do any work during college, make sure that's really obvious. If you're doing 20 hours a week during college, that's a big plus in terms of us looking at that as a significant disadvantage because you're working. We had an individual that worked 40 to 60 hours a week during college and did reasonably well, had some grade issues, but that was a mitigating factor. He was supporting himself and his family. That's a big-time mitigating factor. So for the gap year, post-bac if you want to fix your grades, or not fix, but improve your grades, and work, clinical if you could do it, but you got to do what you got to do, and that's respected.
So we have another question from Brandy. She's a Spanish major in community and culture, and she's wondering whether this will hurt her during the consideration process.
No, again, if you can, you got to have the science prerequisites, obviously. So if you have good science prerequisites and you did well in those classes and your MCAT's okay, so we say, hey, Brandy, we know you can handle the academic rigors. That's we accept that. And then two, you say, you've got consistent in your life. You want to work with the Latino population, or you want to make sure you're fluent in Spanish to work with individuals that are monolingual. That's a plus. So I don't think that's a negative as long as you have good grades in science. You have a good MCAT score so that you show, hey, I did Spanish as my major, but I have what it takes to handle the academic piece of medical school.
So we have another question from Tae-Yoon, and the question was they took 3 organic chemistry courses, but during the second course they got a C+ on it, and they're wondering if this is going to be a problem or whether they have to explain this to the committee.
Yeah, 1 grade probably wouldn't bother me. I mean, one C wouldn't bother me. So we're going to look at patterns. So I look for patterns. If I see 1 not so good grade in 1 science class, I'm not going to worry about it. If your overall GPA is okay, if your MCAT's okay, if you got other science classes where you did okay. Organic chem, I hated it. It was a very difficult class. I did okay in it, but so there's some classes. Physics is sometimes a problem for people where we see, not so great physics grades, but we see good chemistry grades. So as long as your overall picture is okay, I would not explain 1 grade. If you got multiple grades, then again, you probably want to provide some explanation. and then again you're thinking about that postback or something to show that you know you can get it done.
We have a question from Ravni wondering if you mentioned some postback programs and whether you could repeat them again.
So the ones I've seen most commonly, USC, Keck. Now Keck, don't get confused because there's the Keck, there's Keck at USC, but this is Keck at Claremont, one of the Claremont colleges. In fact, I think it's Claremont itself. Those two I've seen very commonly. UCLA, I've seen a fair amount, but remember, I'm getting, at UCR, we're getting, you know, predominantly Southern California applicants. So those are probably the big three I've seen, UCLA, USC, and Keck at Claremont. And they're very good. And again, you know, you do well, you get a good letter, looked at very positively.
We have a question from Bianca. She's wondering, do the prerequisite science courses have to be university level, or are community college acceptable?
So that's a good question, and I have a little bit of a bias, but I work hard to not have the bias, which is they are acceptable. So the basic answer is they are absolutely acceptable. We had a candidate last night that did all his prereqs at a junior college, did well, you know, got transferred to a 4-year. He was one of our accepted applicants. Because again, you know, what we're looking for is that you did the science work, you got good grades. I tend to, and I look at circumstances. So if it looks like that was the route you had to take and you did well, I don't worry about it. If it looks like you had options to be at a 4-year school, you know, then I might look at it a little bit differently. But in general, the answer is yes, that's acceptable, you know, with good grades, and then, you know, showing that you can also do it at the 4-year college level.
Could you explain how the admission committee views the MCAT? Do they look at the overall score, or do they look at specific sections of the exam?
We do both. So we look at the score and the percentile. So we look at, you know, what your percentile ranking is, and we're looking for, yeah, I don't want to give a hard number, but I'd say if you're 70 percentile and above, that's good. If you're in the 80s, that's good. That's better. If you're in the 90s, that's very, very good. But we do look at the specifics. So particularly if you're in the 90th percentile plus, we don't look at the specifics because you're obviously going to do well across the board. But if you're at the border, you're at, you know, 70, 75, 80, then we'll look, I will, and the committee will look at the specifics. So as an example, we might say, we're looking at your grades and we're seeing a little bit of struggle in science, but then we see a really good MCAT score, you know, in the physical and biological. Okay, all right. So you know, that shows that, you know, you're able to, you know, understand the concepts and deliver them on a test. So both. We do look at both. The higher the score, the less we look at the detail.
We have another question from Parstel. They wanted to know whether there's a disadvantage to getting an undergraduate degree from another country but do all the prerequisites in a junior college here in USA.
You know, that I've looked at a whole lot of applications. I mean, I've done, oh my gosh, because I'm a screener as well as, you know, on the committee we screen as well for interviews. I don't know that I've seen that come up or we've talked about it. I would think it probably shouldn't matter as long as, again, you can show that the prereqs were here, that you did well in the science courses, did well on the MCAT. I don't know that that would make a difference. It just hasn't come up. Everybody that I've reviewed has been, you know, some form of American college. I'm trying to think if I don't think I've seen that, but it shouldn't be a problem, particularly if the prereqs and you do well and you have a good MCAT.
So when we were talking briefly about the MCAT, how do you view the CAR section?
You know, that's interesting because I look at that if it's low, if it's particularly low. I mean, I do look at that. If it's, you know, if it's decent, I don't pay that much attention to it specifically. Again, looking for, you know, things to correlate. So, you know, or things to sort of overcome. You know, if, for example, you know, struggled with science early, did better later, good MCAT score on the science section, good to go, right? Difficulty around the car section, not a very good writer, don't present well. Those are red flags. So I'd look at it again. I look everything. What I want to make sure really is the message is one thing doesn't make a difference. Ultimately, it's really the whole picture with some things correlating or not correlating with each other. So cars, I look at it if it's low, and then I try to look at the writing skills and presentation and et cetera.
Okay, let's see. Oh my goodness. We're getting lots of questions in all of a sudden.
Good.
So, quick question from Rovneet. How many hours on average do you see students working overseas?
Say that again.
How many hours on average do you see, like, from application students who are working overseas?
Overseas, yeah. It varies quite a bit. If it's 20 or 30, I'm like, you traveled all that way to work 20 or 30 hours. The longest I saw was 150. That was in an applicant last night, actually. I had not seen that amount before. So 150, I mean, that's either a month or many hours, during a couple of weeks. I would say average is 40 to 80. A week or 2 weeks, roughly, is probably the average. The 150 was an outlier on the top. 20 to 30 is an outlier on the bottom. So again, you got to go. It's back to that same theme. Is the experience real, or is it a touch point to check a box? And can't completely tell that, of course. Other than letters help us, understand if it's real and in depth. So I'd say between 40 and 80, 1 to 2 weeks. Now, if you're doing logistics, so Alice, one other quick thing. If you're doing logistics if you're doing logistics for the mission on the U.S. side, so you're setting it up, doing the scheduling, pulling equipment together, that could be very long. I mean, that can be hundreds of hours. I saw a person who did fish. They had like 2,000 hours because they were doing all of the logistics. So so a little different, but still showing commitment.
Do you like to see applicants that have taken psychology and sociology to get some background in those fields?
Well, I'm biased. My wife is a psychiatrist, so I'm a little biased. But I do like that. I like seeing psychology as a major or a minor, because behavior, just as a comment, an offside comment, if you look at the data around health, impact on health, behavior is number one at about 40%. So in terms of creation of disease or creation of health issues, behavior is number one. Well, okay, that means you got to understand behavior. To understand behavior, nice to have psychology, probably more than sociology, although sociology is group behavior. So I like seeing that personally. I think that's a plus.
Okay, I have someone named Jackson who did lots of experience currently in our program. He's working 25 hours, doing quite a lot of stuff in his own time at the moment. He's wondering whether it would be wise to quit work to invest more of himself into research and clinical work, given that he's having a large work commitment at the moment.
Well, I mean, you got to do what you got to do to survive. So, I mean, I hate to give, blanket advice because it really depends on his circumstances. But you need those experiences. We do want to see research experiences, again, clinical better than basic. And we want to see the clinical experience because that tells us, A, that you understand what it means to be a doctor and how research fits into the medical care system, et cetera. And B, that you're making sure that you really want to do this, particularly the clinical experience, again, the MD shadowing, the ED, whatever. So we do want to see that, and we want to see significant hours. If we see 15 hours of MD shadowing or even 30 or 40, that's not very meaningful. So again, I don't want to, tell him not to work if he needs to work, but we do need to see those experiences in the application.
How important is it in terms of pursuing depth versus variety?
I'm, as you heard me, I'm big on depth. And so you need to be in all the different areas. So you need the research, you need the clinical, you need the various categories of experience. But I love to see depth for two reasons. One is it shows commitment, and two, you're going to get a better letter. I mean, if you really are, if you have the depth, you're there, well, you should get a better letter. Maybe that's a better way to put it. So I tend to like depth. I'll see occasionally, literally, 60 to 8 hours of research, maybe 100, then another research for 150, then another research for 200. I don't know what that is. I don't know what that means. Whereas if I see research for 1,000 hours, I mean, that's a real commitment. And often that leads to a job. I see a lot of times where they're volunteer and then they become a paid lab assistant, so that's cool for the income. So depth is that shows commitment, and again, you can often get a much better letter, which then it ties it all together.
So a few more questions. How do you consider informal baccalaureates at a community college, Cal States, or extension courses?
I'm sorry, say that again.
How do you consider informal baccalaureates at a community college, Cal States, or extension courses?
Extension, I don't see a lot of that. I'm not sure how I would look at that because those are kind of different. But what we talked about, junior colleges and a Cal State, perfectly acceptable. Do the science courses, get good grades. That there is no standard. There's no standard that says you must get an A in organic chemistry from a 4-year school. There's nothing like that. So those are fine. If I see you finished college and then you're going back and taking just sort of semi-random courses at a junior college, I don't see that as that meaningful versus doing a post-bac or doing a master's, that particularly, again, if you're trying to, compensate a little bit for having a rough time in college. So I only if those courses were pertinent would they be more meaningful.
I'm going to answer this question, Brandy, because we're running a little low on time. Are extracurricular activities such as being vice president of the campus's honor society or being a member in a pre-med club taken into consideration?
So those would be low on the list. So I'll tell you the things that for me and for the committee are often low on the list. A leadership position in a fraternity or sorority, a leadership position in a club. Now, if you're a leader in, like, for example, if you're a leader of the student-run free clinic, you're on the board of directors, you help with logistics, you sometimes volunteer in the clinic, again, fits. It all comes together. I'm committed, I'm spending time, I'm working on this thing that's helping to deliver care for people. But when it's leadership in something that is not as relevant, like fraternity, sorority, like a club that's, it depends on the club, obviously. Sports, I look at from a time commitment thing, but because I've had a lot of varsity sports people as applicants, not going to be a big decider. Tells me you're very disciplined. If you're a varsity level athlete at a college, you're very disciplined, you're very focused, but it's in a particular area that's not totally relevant to medical, to healthcare. So those, not that helpful. Not hurtful, but not that helpful.
Well, I think that's all the time we have for. I'm sure you guys all have lots of questions. Dr. Gilbert, if you're interested, you can share with me your email address, and I'll share with those that attended this webinar so they can send over any additional questions they may have. I'm sure they have lots more questions, but and specific cases that we just don't have time to answer. But I'd like to thank everyone for attending this webinar. As promised, I will send out an email to where you can obtain the slides or outline of this, and you can also view it on our YouTube channel at Cope Health Scholars once it is uploaded. So thank you again, and have a great evening.
Thanks, everybody. Hope it was helpful.